Hello, I'm Amanda Fisher, student physical therapist at Ohio University. Today I'm going to show you how to utilize the manual Hoyer lift. This is used when transferring dependent patients to and from a bed to a wheelchair. Some of the prep requirements you want to start out with are positioning the wheelchair. So you're going to want to make sure to have the wheelchair locked and at the end of the bed face perpendicular. You will refer to skill 12 for positioning of the sling. As you can see, the patient's already in it. And then lastly, you're going to want to make sure to ask your patient for permission to move them. Is it okay if I move you? Before you begin using the lift, you're going to want to tell the patient to remain still in the sling and to have their arms crossed. First, you're going to start out by locking the brakes on the Hoyer lift. And the base of the lift should be in a narrow base setting. Before I begin moving her in the air, I'm going to have another healthcare professional help me to bring her up out of the bed. Instruct the other healthcare provider to hold the legs of the patient while maneuvering them into the wheelchair, and you're going to want to move the lift 90 degrees toward the wheelchair, and while the patient is suspended, the other healthcare professional will help guide them in the air and into the wheelchair. Begin pumping the lift with the hydraulic release valve closed. Another healthcare provider is going to help stabilize the patient's legs. And you are done when the patient's buttock is 1 to 2 inches off of the bed. Now you can unlock the wheels, change the setting to a wide base, and begin moving the lift 90 degrees toward the wheelchair. Okay, now the healthcare provider is going to help by guiding the patient's pelvis into the chair. And I am releasing the valve. Once you have the patient positioned in the wheelchair, you're going to remove the Hoyer lift from the sling by removing the straps from the spreader bar, and you are going to remove the sling from underneath the patient by referring to instructions in skill 12. Once that's removed, you're going to refer to skill 17 on how to reassemble the wheelchair and make sure that the patient is comfortable. You're going to check and see that their posture is correct to avoid developing pressure ulcers. Now we're going to begin lifting the patient out of the wheelchair and back to the bed. Start pumping the lift, and another healthcare provider is going to stabilize the legs while they're being lifted. Now you can unlock the wheels and begin moving the patient. Return the base to a narrow setting. Lock the wheels. And then release the valve and slowly release the patient into the bed. The healthcare provider is going to be holding her legs, and I'll guide her trunk and head for support. The lift that I just showed you is a manual Hoyer lift, but you can also use an electric Hoyer lift. This is suspended from the ceiling, and the spreader bar will attach to the straps on the sling, and it will be controlled by a remote. So that's going to move the patient into the wheelchair. The difference with the wheelchair placement is you're going to want to have it parallel to the bed instead of sitting perpendicular.